Many people view an acne scar as a permanent mark left behind after a bad breakout, but an atrophic or indented scar is actually an active, ongoing structural failure site beneath the surface of the skin. Severe acne inflammation triggers the release of enzymes called matrix metalloproteinases, or MMPs. MMPs are endogenous proteases, essentially biological scissors, that slice through the structural collagen fibers, keeping your skin tight and smooth. Once the acne clears, the body struggles to replace those severed fibers. The normal transition from inflammation to the building of new tissue is delayed or halted, leaving a physical void where a dense network of collagen used to be. Smoothing an indented scar involves solving a structural engineering problem. To raise the skin's surface, the body must manufacture and install a new network of physical scaffolding. Dermatologists often turn to clinical procedures like fractional lasers and microneedling to fix these structural deficits. These procedures work by inducing controlled trauma, intentionally injuring the skin to force the body to restart its wound-healing cascade. This creates a biological bottleneck. These clinical treatments demand a massive and rapid synthesis of new collagen to fill the microscopic wounds they just created. If a patient's natural supply of amino acids and signaling proteins is depleted, the skin's capacity to heal hits a hard ceiling. Paying for an expensive laser resurfacing session is like pressing the accelerator to the floor. If the body lacks the raw materials to rebuild, the biological gas tank is empty, and the results plateau. Curious, instructive, this is where bioactive collagen peptides and topical peptides enter the picture. They provide the missing fuel, priming the skin with the exact amino acids and molecular signals needed before those intense clinical procedures even begin. Physical dermatology acts as the necessary catalyst to kickstart the repair process. Molecular collagen provides the actual building blocks required to fill the crater. A common assumption is that swallowing a collagen supplement is useless because stomach acid will completely dissolve the protein long before it gets anywhere near your face. However, clinical radio-labeled studies show that hydrolyzed bioactive collagen peptides, which are collagen proteins broken down into much smaller chains, survive the digestive tract and enter the bloodstream fully intact. This is an excerpt from a medical journal showing a consensus statement from dermatological experts highlighting the use of topical peptides for revising acne scars. Dermatologists apply these specific protein fragments directly to the skin as anti-inflammatory messengers. Whether applied topically or delivered through the bloodstream, these peptides reach the dermis and exert a chemotactic effect. Chemotaxis is a biological process where cells direct their movement according to chemical signals, effectively sounding a localized alarm at the site of the scar. This alarm activates dormant fibroblast cells, the specific factories in your connective tissue responsible for producing collagen. Once activated, they pump out fresh type 1 and type 3 collagen to physically fill the indented scar from below. These peptides bind to specific receptors in the skin, an interaction that commands the skin's biological factories to resume the production of structural tissue. The peptides also act as a protective shield by inhibiting MMP1 and MMP3, the scissor enzymes that degrade collagen. By stopping enzymatic breakdown, the new matrix is protected. Peptides also stimulate fibroblasts to produce hyaluronic acid, a vital substance acting like a biological sponge. As this biological sponge absorbs water, a flood of hydration physically plumps the surrounding tissue from the inside out. This rapid increase in volume visibly decreases the contrast between the indented scar and healthy skin, making the harsh edges look shallower. To verify these molecular mechanisms, researchers published a comprehensive umbrella review in 2026 that synthesized data from 16 meta-analyses involving nearly 8,000 patients. This massive dataset provided high-certainty evidence that daily collagen peptide supplementation measurably improves skin elasticity, actively boosts hydration, and increases overall dermal density. By commanding new structural growth, shielding that growth from enzymatic destruction, and hydrating the surrounding tissue, peptides provide a complete molecular defense against atrophic scarring. Can a daily collagen supplement perfectly erase a severe 10-year-old ice pick scar all by itself? This is a consensus table showing that 80% of participating dermatologists report peptides improve healing and reduce side effects from invasive procedures. These peptides function as a nutritional primer, ensuring the body has the internal resources to respond to clinical remodeling. The science-backed protocol starts with dosage. Patients need to consume between 2.5 and 10 grams of hydrolyzed marine or bovine collagen daily. Crucially, this supplementation should begin 4 to 8 weeks prior to any dermatological procedure, like microneedling. This lead time ensures the skin's reservoir is fully loaded with amino acids before the controlled trauma occurs. Structural skin remodeling is a long game. Measurable changes in scar depth and dermal density require strict daily consistency for a minimum of 12 weeks. Effectively treating acne scars requires fighting a two-front war. It demands outside-in physical intervention to break up the old tissue and inside-out biological support to build the new foundation. While clinical lasers and needles provide the biological demand for healing, collagen peptides supply the exact molecular language and materials your body needs to finally close the wound.